Acute liver failure, it's a condition that just doesn't wait. It strikes fast, it is incredibly dangerous, and it demands an immediate life or death kind of response. Okay, let's dive right into this critical medical emergency.
So, just so you know, everything we're about to cover, all the causes, the symptoms, and that frantic race to treat it, is pulled directly from this really comprehensive infographic. It basically lays out the entire clinical picture for us.
The very first thing to get your head around is the sheer urgency here. This is not some chronic illness that develops over years. Nope, this is an all-hands-on-deck crisis that can literally unfold in just a matter of days or weeks.
So what exactly are we dealing with here? Let's start our little investigation with the most basic definition. What is it that makes this condition so unique and honestly, so alarming?
Okay, the two words that define this whole thing are sudden and no prior history. This isn't about long-term damage from, say, years of drinking. This can happen to someone who is perfectly healthy just a few weeks before, which you have to admit is what makes it so terrifying.
In this number right here, it really drives home what acute means in this context. The whole process, from the very first sign of liver injury to the really serious complications, happens in less than 26 weeks. That incredibly fast timeline is exactly what makes it such a huge challenge for doctors.
So to make a definitive diagnosis, doctors are looking for this very specific trifecta of evidence. First, you've got to have blood tests that clearly show the liver is injured. Second, something called coagulopathy. See, the liver makes stuff that helps your blood clot. When it fails, your blood can't clot right, which is super dangerous. And third, encephalopathy, which is just a change in your mental state because the failing liver can't filter out toxins, and those toxins start messing with the brain. All three have to be there.
Right. So, if it's not some pre-existing condition, what on earth triggers this catastrophic failure? Let's keep going with our investigation and take a look at the list of the main suspects.
Before I show you the list, just take a guess. What do you think is the #1 culprit behind this condition, at least in many parts of the world? I bet the answer might surprise you.
The answer is an acetaminophen overdose. Yeah, the active ingredient in a ton of common pain relievers. It's the leading cause, because in really large doses, a toxic byproduct just completely overwhelms the liver's ability to clean things up, and that causes massive cell death. But as you can see, the list of other suspects is pretty varied. We're talking everything from toxins like poisonous mushrooms and viral infections to complications from pregnancy and severe circulatory shock.
Okay, so with the suspects all lined up, how do doctors even begin their investigation? Well, they start by searching for clues, and the first signs are the warning signals the patient's own body sends out.
These are the classic clues, right? Jaundice, that telltale yellowing of the skin and eyes, pops up because the liver just can't process bilirubin anymore. Pain up in the top right of the abdomen, right where the liver is also super common. But look at the other signs too. This profound fatigue, nausea, and, critically, confusion. That's the encephalopathy we were just talking about.
But of course, symptoms alone are never enough. The clinical investigators have to confirm these clues with a whole battery of tests. They'll do blood work to see how the liver is functioning, cultures to check for any infections, and then advanced imaging to get a direct look at the organ itself.
Now, when the liver fails, the fallout isn't just contained to that one organ. Oh no. The consequences ripple throughout the entire body, and that can lead to a cascade of life-threatening complications.
So here's the thing to remember. The liver is like a central processing hub for the body. When it goes offline, it's just chaos. Toxins build up and can cause the brain to swell. That's cerebral edema. The body's immune system gets weaker, which raises the risk of a widespread infection, or sepsis. We already talked about the bleeding risks, and because the liver stores sugar, its failure can lead to dangerously low blood glucose levels.
Of all these complications, the impact on the brain, that hepatic encephalopathy, is one of the most critical ways they measure how severe the situation is. Doctors actually use a grading system to track just how badly the patient's mental state is being affected. This grading system charts the patient's neurological decline with, honestly, chilling precision. It can start off pretty subtly at grade 1 with just some mild confusion. By grade 2, they're lethargic and might have this characteristic hand tremor. Grade 3 is severe. The patient is really difficult to wake up and their speech might be incoherent. And then finally, grade 4 is a full coma. This scale is an absolutely vital moment-to-moment tool for the ICU team.
So, we've got the diagnosis, we know the causes, and we see the complications. Now it is a flat-out race against time. The rapid response is all about immediate, aggressive treatment.
And this is the absolute golden rule. You cannot fix the problem until you stop what's causing it in the first place. If it's an acetaminophen overdose, you give the antidote. If it's a virus, you start antivirals. Every other treatment is just about supporting the patient while you attack the root cause.
The treatment protocol is basically a multi-front battle. Step 1, like we said, is hitting it with antidotes and specific meds. Step 2 is intense ICU management. We're talking constantly checking their neurological status, their blood sugar, everything. Step 3 is directly tackling the complications as they pop up, like using specific drugs for brain swelling. And then, Step 4, preparing for an emergency liver transplant, which is often the only thing that can truly provide a cure.
So if there's one thing to take away from all this, it's the sheer speed and severity. From a common painkiller to a poisonous mushroom, the trigger can set off this incredibly rapid cascade that requires one of the most intensive medical responses you can imagine. Every single second truly does count.
And all this really leaves us with a final thought, doesn't it? Knowing that the most common cause is something found in nearly every single home, it kind of makes you wonder, how can we get better at recognizing the risks that might be hiding in plain sight right there in our own medicine cabinets?